Fracture and its types. What is a fracture? Fracture is a medical condition when the continuity of the bone is broken. Bone may be completely or partially fractured in any number of ways, like crosswise, lengthwise, or in multiple pieces. Common types of fracture. Stable fracture. The broken ends of the bone line up and are barely out of place. Open compound fracture. Skin may be pierced by the bone. Avulsion fracture. A muscle or ligament pulls on the bone, fracturing it. Comminuted fracture. Bone is shattered into many pieces. Compression or crush fracture generally occurs in the spongy bone in the spine, causing a collapse of the front portion of a vertebrae in the spine. Fracture dislocation. A joint becomes dislocated. Green stick fracture. The bone partly fractures on one side but does not break because the rest of the bone can bend. It is more common among children whose bones are more elastic. Hairline fracture. Partial fracture to the bone. Impacted fracture. One fragment of fractured bone goes into another. Longitudinal fracture. Break is along the length of the bone. Oblique fracture. Fracture that is diagonal to a bone's long axis. Stress fracture. More common among athletes because of repeated stress and strains. Torus fracture. Bone deforms but does not crack. Transverse fracture. A straight break across a bone. Causes. Most fractures are caused by fall and accidents. Osteoporosis. A disorder that weakens bones and breaks easily. Overuse that can cause stress fractures. Signs and symptoms. Pain, swelling, bruising, discolored skin around the affected area, angulation, affected area bend at an unusual angle. Patient cannot put weight or move the affected area. In open fracture, there may be bleeding, dizziness, sickness, and nausea when a large bone is affected. Diagnosis. Physical examination, X-ray, MRI, CT scan. Treatment. Immobilization casts, plaster casts, slings, metal plates and screws, external fixators, physiotherapy, surgery. Healing. Inflammation caused by clotting of blood in the affected area. Bone production. Fibrous tissue and cartilage gets replaced in the place of inflammation. Bone remodeling. Bone continues to form and becomes compact to bear the weight. Generally, healing takes 6 to 12 weeks. Healing is faster in children. Also depends on the location and severity of the fracture. Prevention: adequate nutrition and sunlight to maintain the calcium and vitamin D levels. Physical activity makes the bones stronger. Menopause: take precautions to avoid the risk of osteoporosis. Types of fractures in detail. Bankart's fracture. Anterior shoulder dislocation, related to external rotation and abduction of shoulder. Barton's fracture. Dislocation of the radiocarpal joint happens when one falls on outstretched hand. Bennett's fracture. Break in the lower part of thumb, load on the partially fixed thumb. Bosworth fracture. Fracture and dislocation of distal fibula and proximal fibula. Rotation of foot. Boxer's fracture. Fracture of neck or little finger of head punching solid object. Bumper fracture. Compression of lateral tibial plateau, affects knee when struck from side by car bumper. Schaffer's fracture. Intra-articular of radial styloid, causes a deviation in the wrist. Cole's fracture. Distal radius fracture with dorsal angulation, caused when the fall is on outstretched hand. Essex-Lopresti fracture. Radial head fracture with interosseous membrane disruption and distal radial joint fracture. Fall from height. Galeazzi fracture. Distal radius fracture, blow to forearm. Gosselin fracture. V-shaped fracture extending to ankle joint. Hill-Sachs fracture is a cortical depression in the posterolateral head of the humerus, occurs during anterior shoulder dislocation. Holston-Lewis fracture. Fracture and entrapment of the distal radial nerve. Hume fracture. Fracture in the elbow with anterior dislocation of radial head. Jones fracture. Fracture of intermetatarsal joint, inversion of ankle. Lisfranc fracture. Fracture dislocation of midfoot, dropping heavy weight on foot. Maisonneuve fracture. Spiral fracture of proximal fibula, external rotation of ankle. March fracture. Stress fracture occurring in the weight-bearing bones of the lower limb. Montague fracture. Proximal ulnar fracture with dislocation of radial head, blow to forearm. Potts fracture. Bimalleolar fracture of the ankle, eversion of ankle. Rolando fracture, intra-articular comminuted fracture of base of first metacarpal. Axial load along the metacarpal causing splitting of the proximal articular surface. Salter-Harris fracture. Fracture in an injury to the growth plate area of a child's bone. Fracture occurs when a force hits the growth plate, separating the rounded edge of the bone from the bone shaft. Shepherd's fracture. Injury to lateral tubercle is caused by inversion or extreme equinus. Smith's fracture. Distal radius fracture with volar displacement. Fall on outstretched hand with wrist in flexed position. Toddler's fracture. Non-displaced spiral fracture of distal tibia in children under 8 years old. Low energy trauma, often rotational. Disclaimer: this information is provided as an educational service and is not intended to serve as medical advice. Anyone seeking specific medical advice or assistance should consult his or her doctor or therapist.